Hello and welcome to another episode of Discover with Spinati. I'm your host, none other than Dr. Spinati. And today we're talking about dentures. This whole week we've been talking about implants. And today we're going to talk about dentures because it falls in line with missing teeth and it falls in line with you losing a lot of things if you don't have teeth. And so we're going to talk about why not dentures, which a lot of people don't know. I mean, quite a bit of people don't know because they think that dentures is a good alternative. It is an alternative, but it's not a good one. It's an alternative for people who want something transitionary. So if they want something in between the time that they're actually getting an implant or a bridge, then they can maybe opt out for a denture. But there are a lot of downsides to dentures, and I want to make it clear to everybody that there are so many downsides to dentures. Really, the only upside to dentures is that they're cheap. But you and I both know when something is cheap, is that usually a good option? When something is cheap, it means that you are compromising quite a bit of things about all the other aspects of why it is cheap. And when it comes to your health, you don't want to go cheap. You don't want to go cheap when you're replacing your hip. You want the best hip, obviously, because you don't want to be limping. You don't want pain. You don't want to have any further issues. And same thing when it comes to your jaw and your teeth. So there are a few things here that I want to discuss with regards to why dentures are a terrible option, although they're an option. Terrible option, absolutely terrible option. And I really want everyone to know this. So here, of course, I went to Google and went to these images, and you can see it right here. These lovely, lovely images. Let me see if I can, actually, you know what, probably better this way. All right. The first thing I want to go through with you is that dentures, they don't preserve your bone. So if something is not inside your bone, such as a tooth or an implant, your bone and your gums start to go away, like literally go away. So imagine you have a missing finger. So imagine your finger is all of a sudden missing. Now you have one finger less, right? Or imagine, a part of your arm is missing, if you have like gangrene or whatever. Like that's how severe it is. So when you're missing a tooth, you're actually losing the bone and you're losing gum tissue. Like it's very hard to wrap your head around it because you're like, wow, like I'm actually losing like my body. You're actually losing it. So that's what dentures promote. They promote loss of your bone tissue and your gum tissue. That's the first terrible thing. And as you can see here, you can see this illustration of healthy jaw progressively with less bone, and you have severe bone loss, okay, or they call it atrophy. So here you can see here, and I want to point specifically to this area right here and this area right here. This here is called the nasolabial fold right here. And this person, by the way, is the same exact person within maybe a few months. Like we're not talking a lot, okay? Maybe depending on the person, maybe a little bit more than a few months. But this is not like decades later, right? So automatically, and there are some people on TikTok that they're very young, like in their 20s, and they've lost all their teeth because of, drug addiction or whatever, and they've lost all their teeth, and they without something inside their mouth, because they use dentures and then they transitioned into something more permanent. But when they didn't have anything inside their mouth, they looked like they were 70 years old, literally like 50 to 70 years old, and they're just in their 20s. So the reason why is because your nasolabial fold here, as we get older, naturally speaking, this part right here becomes more grooved in, right? Like it becomes deeper as you get older, this part. Well, without not dentures, without teeth and with a loss of bone, what happens is that this part becomes deep. So you start aging super fast because it's not a natural progression anymore. Now it's a consequence of loss of actual organs inside your mouth. Same thing with this part right here, okay, your lower jaw. So with the loss of the bone, you have less. So you can see here, there's a collapse, right? Like if you were to draw a line here, this is a straight line, then you can see there's a concavity here because obviously there's no tooth or teeth to support the tissue. And here there's no more bone or teeth to support tissue. So now these things are inward. And that's how we look like when we get older, is that these things start to go inward. And you start getting the sagginess here because the skin is not being upheld by any kind of teeth or bone. And because here what we call the vertical dimension, which is just the, like, let's say if you were to put a line from here, the tip of the nose to the tip of the chin, you were to measure from here to here, now it's shorter. Well, if it's shorter, then obviously you're going to have extra skin that's going to be hanging around, right? You may still be in your late 20s if even if you don't have any of your teeth, but you're going to look like you're in your 60s because of all these changes. So that's and this is the consequence of not having teeth inside your bones. Now, dentures by themselves, like let's say you're doing, so this is complete loss of teeth. Let's say you have partial loss of teeth. If you have partial loss of teeth, then the situation, I mean, there's a reason why people end up with no teeth. It's not like all of a sudden they wake up and they're like, I don't have any more teeth. No, like it's a progressive loss of teeth. So when you start off with partial dentures, so dentures that have clasps, for instance, like for instance, this guy. Oh, let me go back to this right here. This guy right here, these clasps. Now, the reason why when people start off with partial dentures, they end up with full dentures is because of this phenomenon here. So when you put clasps, okay, when you're putting these metal things or whatever, sometimes they're plastic, whatever clasps, they're grabbing onto the teeth every time you're biting on this side. So let's say there is a downward, right? There's a downward force on these teeth here, right? On the plastic teeth, on the denture teeth. There's a downward force. Well, this is now being pushed upward. So this is causing a slow extraction of your tooth. So the teeth actually start become more mobile. Furthermore, this part right here, because obviously you're going to be using this in public, so you're going to be eating with these. And so as you eat, naturally, without dentures, with your teeth, naturally when you eat, the saliva and everything just kind of washes off the majority of the plaque. It doesn't stick around. The plaque is what contains all the bad bacteria that cause the cavities and cause all the periodontitis and all the bad stuff. Well, here you don't have that luxury anymore because now you have all this part here, this metal, and specifically this where the tooth is and where the denture is. This is where the food gets stuck. The plaque builds up severely, and now you have decay. Yeah, now you have cavities which progress over time, and you don't feel it because it progresses slowly over time, and you don't feel it. It's just all of a sudden now you can't keep that tooth anymore because the cavity has become so deep. Literally had that patient with me yesterday. Okay, so the exact same scenario, and he didn't know this, and I showed him. I'm just telling you, dentures, like I said, it's an option, but it's a terrible option. It's like me saying, well, I mean, if you can't afford rent, for instance, I don't know. That's probably a really bad thing. I don't know. I can't think of an example right now. But if you're to think of something, because it involves your health, right? Like I'm not talking materialistic. I'm talking about your health. Like you're losing gum tissue, you're losing bone tissue, you're losing tooth tissue, like you're losing a lot of tissue simply by opting for something that isn't so great. Now, one of the arguments that we get quite often is that, well, I mean, you can't afford the alternative, can't afford implants. Okay, well, here's the thing. One, that should never be the reason why, because there are a lot of financing options. Okay, so we do have financing internally in Spinetti Dentistry. We do have financing options. So I mean, cost should never be a factor because you can definitely split up your payments over months. So that shouldn't be the factor. But even if we didn't have financing, what I want to point out is that you can't afford to have the cheap option. You can't afford not to have implants. And the reason I say that is because you're going to lose your teeth and you're going to sacrifice your quality of life. And if you're sacrificing your quality of life, I mean, you know what they say a healthy person has 1,000 wishes. A sick person only has one, right? Which is to get healthy. So you're actually heading towards non-healthy, right? And then your only wish is going to be for you to get healthy. So why even go in that trajectory? Find options. There are a lot of options, right? Like when you come to Spinetti Dentistry, there are options for you to be able to afford any treatment. And that's what We've gone out of our way to make sure that you can actually afford it. And, we go out of our way to educate you, to let you know, okay, like yes, that's an option, but it's not a good one. So we talked about that increases your cavities, increases plaque. We talked about, okay, so one other thing is that increases mobility. So your tooth actually becomes more mobile, right, over time, because as you can see here, like this is a very simple example. So if you put pressure here, you're going to be slowly extracting this part right here, right? You're going to be losing bone right here. So over time, these teeth are going to start becoming looser, right? More and more loose. And they're going to be more prone to cavities. You're also going to be prone to gum disease, right? Because same exact concept. It's also incredibly anesthetic, right? Like let's talk about the truth here. Like if you have clasps, these metal clasps or whatever, and you're smiling, like it doesn't look good, right? So people go at lengths in order for them to try to look good, right? With either Botox or some surgeries or whatever. Like this is literally it's a metal piece inside your mouth. Every time you smile, it shows metal. So even if you don't want people to see you don't have teeth, they'll know you have dentures. So it's not really something that's great. And it's something to think about when you think about your options. It's really something to think about. Um and again, I'm not knocking the option of dentures. I'm just saying that dentures is not the best option. It is not the best option. It's the least option. It's the least option that you should actually think about for your long-term health. Okay, I should stress that. Like let's say for instance you're getting an implants or you're getting implants or whatever. You want something transitionary as I discussed in the beginning of this podcast. Well, you're going to need something, right? But it's transitionary, so it's not going to be very long. It's going to be a few months while the implants and the bone heals. So then you put something on there in order for you to be able to, chew and function. But that's it. Like to me, that's literally the only good case use of these dentures. Otherwise, I've only seen bad things with dentures, with people losing bone, losing gum tissue, not being able to speak properly, with the dentures falling out, dentures being loose, them not being able to speak. He even shared stories with me that they won't even go inside the pool because they're afraid if they go in the pool and they put their head underneath the water, then all of a sudden now the denture is going to fly out and they're obviously going to be incredibly embarrassed. Furthermore, you have a lot of sore spots that start to develop because of this stuff, right? So you get because of the way that the pressure and the friction that happens with the denture against the tissue, what happens is that you start getting these sore spots. You start getting, sometimes it becomes ulcerated, it becomes very uncomfortable. Then you have to go back and reline it, and it affects your speech, as I mentioned. So there's a lot of things. There's a lot of downsides in order for you to be accommodating this denture nature of the denture. And if you don't get anything, then obviously you're sacrificing a lot more as well. So, doing nothing and getting dentures, to me, if you were to ask me, my personal opinion, that's not a good option. It's definitely an option, right? You can always not do anything, but there's consequences, and there's always consequences to you doing, opting for dentures. And if you have any questions regarding dentures and whether dentures are right for you or how long you should be in dentures or so on and so forth, or what kind of dentures there are, because there are dentures that are right now that fit on top of implants, and those are fixed, right? So if you've lost all your teeth and you still want something, you want to be able to chew properly, you want an alternative, then there are alternatives for you to be able to actually have a denture, but it's not the same denture as if the one that don't have implants, but you have implants that are inserted. Actually, you know what? I'm going to show it to you because it's right here. It looks like this. Okay, so you have these right here, these implants. Okay, they call those mini implants with these implants here, and then this clasps onto that. Okay, that's a much better option than for you not to have these things here, right? And then this starts sliding around, and you won't be able to chew on it, and so on and so forth. Okay, so if you have any questions, feel free to feed them to me. And as always, keep smiling.